Hi, I'm Justin Riley. Today on Wisconsin Doctors, athletic trainers. They're in a lot of different places that we might not expect, including schools, businesses, and of course, athletic teams. They're out in the community, they're helping us out with our day-to-day injuries, and we're here at Upland Hills Health to learn a little bit more about what they do and how they help us. My guests will include Donnie Schroffnagel, Mike Schipek, and Casey Spangler, all part of the athletic training team here at Upland Hills Health. It's all coming up right here on Wisconsin Doctors. Stick around. And welcome back to Wisconsin Doctors. We are here on location at Upland Hills Health in Dodgeville, and we are joined by the athletic training team. Here, part of the Therapy and Wellness Center here at Upland Hills Health, and we've never been joined by the athletic training team, but I'm so delighted to have Donnie Schroffnagel, Mike Schipek, and Casey Spangler joining us today. Welcome, folks. Good to have you with us.
Thanks for having us.
Yeah. So I'd like to start out by asking each of you to tell us a little bit about yourself, include where you're from, where you went to school, and how long you've been at Upland Hills. So Donnie, let's start with you.
Okay. I'm from Verona, Wisconsin. I graduated from University of Wisconsin Stevens Point with a Bachelor of Science in Athletic Training.
Go Pointers!
Yeah. I've been here at Upland Hills Health since last summer, and so far it's been great. I work at the local high schools as well as in the orthopedic clinic and seeing outpatient therapy.
Excellent, excellent. And Mike, how about you?
So I'm from Oak Creek, Wisconsin, which is just south of Milwaukee. I went to the school at the University of Wisconsin-Madison, where I got my Bachelor's of Science in Athletic Training. I've been here at Upland Hills since the summer of last year, so just close to my first year here. I primarily work at 2 local high schools, as well as the orthopedic clinic and in outpatient therapy.
Excellent. And Casey?
I grew up on the north side of Madison. I went to Winona State for my undergraduate degree in athletic training. I went on to earn my master's degree at Ohio University. I graduated in 2012, decided to move back to wonderful Wisconsin, and I've been working at Upland Hills since then.
Wonderful Wisconsin.
Yes. Primarily I work in Dr. Self's clinic, working with him and Melissa in orthopedics.
Okay.
And then I go over to one of the local businesses and see outpatients over there. And then from time to time, I can be found at one of the local high schools as well.
Excellent, excellent. That's great. So, Mike, I'm going to jump over to you real quick. You know, when people think athletic training, it literally sounds like you are training athletes. But you're working within a hospital setting, so help me understand what it is that you do typically. What is athletic training?
So athletic training is a relatively new profession.
Okay.
It started in about the 1950s. So back then it was focused primarily on athletes. Since then the profession has evolved and it's been expanded to many different settings. Athletic training is an allied healthcare profession. It encompasses prevention, examination, diagnosis, treatment, and rehabilitation of both acute and chronic injuries and illnesses. So, you know, based on our skill set, people have realized that, you know, we're good in many different settings, so then it's kind of expanded from there.
Absolutely. And what led you to pursuing a career in athletic training?
So I've always wanted to do something in the healthcare field. I really enjoyed anatomy, the musculoskeletal system, orthopedics in general, and I also had that kind of sports medicine background that I kind of wanted to focus on. So in college I took an introductory class and the rest is history. I fell in love with it and here I am.
Excellent. That's a great story. And Casey, I'm going to turn to you for just a moment here. From your point of view, what does it take to be an athletic trainer? What sort of personality strengths are needed for a job like this?
Sure. I think in terms of personality, it's important to have a strong set of social skills. We spend a lot of time educating the patient and their families about what's going on. And then also, it's important to have a clear channel of communication between the patient and any other providers that they may be seeing, including but not limited to their physician. Maybe they're also seeing a dietitian or a mental health counselor. It's important to make sure that everybody's on the same page regarding this patient. And oftentimes we're relaying information to, say, maybe their athletic coaches or their supervisors at work discussing what kind of restrictions they have and what they can and can't do. And again, it's important to have that clear communication and keep everybody on the same page. Another big thing I think is compassion. These people are coming to us, they're in pain, they're vulnerable, and it's our responsibility to make these people feel comfortable, earn their trust, and hope that they can trust us to guide them in getting them back to health again.
I see your colleagues are nodding in agreement with you. That's excellent. I mean, I think there really is a compassion is important when people come to you and they're vulnerable like that, for sure.
And a lot of times too, we end up getting to know the patient very well, just because we're kind of that center of the care. We're the ones who are advocating to other professionals and their coaches and supervisors and all that stuff. So they look to us a lot to help, from a mental and physical standpoint.
Sure. Acting as an advocate, I love that. And what influenced you to go into athletic training, Casey?
Well, I've been that person. My first exposure to athletic training was when I was in high school. I was a pretty shy kid growing up, and it took every ounce of courage I had to get up the nerve to ask my athletic trainer to look at my injury.
Sure.
I ended up missing a lot of time, spent a lot of time on the sidelines because of this injury, and too much time, and it's a bummer when you want to do something and you can't because it hurts or your body won't let you. And somewhere in there was when I decided that I want to be that person to help people get back to doing what they want to do as quickly and as safely as possible.
I imagine that some people might feel like that's a sign of weakness to admit that they're too injured to do something.
Yeah, it's sometimes for people it's a big deal for them to come out and ask for help.
Yeah, absolutely. We got to take a short break here, but when we come back, we're going to talk about a day in the life of an athletic trainer here at Upland Hills Health, right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We are on location at Upland Hills Health here in Dodgeville, and we've been learning about athletic training, and we've been hearing about the athletic training team here at Upland Hills Health. And we're going to talk a little bit in just a moment about a day in the life, a typical day in the life of an athletic trainer here at Upland Hills Health. But first, Donnie, I want to go to you for a second, because we didn't get a chance to ask you, how did you get into, what brought you to the field of athletic training?
Okay. Well, I didn't always know what I wanted to do, later on in life. But I know that I wanted to be there to help people and kind of give back. I've always had an interest in science and anatomy and how the body works, as well as athletics, being a high school athlete myself. So finding a career that kind of encompassed all those things, helping people getting back to what they want to do.
Sure.
Athletic training was perfect for me.
There you go. And what are some of the options for job placement when it comes to athletic trainers? Where can they find work?
Well, like Mike said, our field is expanding.
Sure.
And is continuing to expand. You can see us working with sports teams, whether it's high school, middle school, or even at the college or professional level. Athletic trainers can also be found working in hospitals and clinics, even in the industrial setting. They're also found working in the military, providing services and skills, to the armed forces, those who need it there. And then more recently, they've also been used in performing arts to dancers and.
Oh wow! Okay. Real quick, Donnie, I want to just kind of get an idea of what is it like to work in a high school setting.
Well, one of the things I like most about athletic training is that every day is something new.
Yeah.
So it's hard to say what a typical day is, just because we're doing something completely different every day. But generally, we'll go to the schools at the end of the day, see the student athletes, whether it's for an evaluation or treatment of an existing or a newly sustained injury. From there, we might also help with their return to play, participation, or progression, whether or not they have any restrictions from their physician. We also might help to, like a lot of us have been saying, that bridge between different providers if they need to go see their primary doctor or a specialist. And then we also cover events, which means providing first aid or really being there to identify if there's an emergency situation that might have occurred resulting from an injury.
Now, the three of you also work for the orthopedics team here at Upland Hills Health. And Mike, I'm going to jump over to you real quick. Talk to us a little bit about who you work with directly here and how you help to assist them in what they do.
Right, so we work with Dr. Self, who's the orthopedic
Sure.
surgeon here at Upland Hills, and we also work with Melissa Messer, who is the physician's assistant.
Sure.
So our job there is we primarily see the consultation. So if you're a new patient, you come in for the first time, we'll go in first, we'll get a good history, do a physical exam, and report our findings to Dr. Self. Afterwards, depending on the plan of care, if it's appropriate, we'll give you home exercises to do so you can get on that right track to getting better and on the way to recovery. We also see after you've had surgery, we'll kind of show you some exercises you can do at home as well to kind of bridge that gap between surgery and then physical therapy later down the road.
Absolutely, bridging the gap between surgery and physical therapy. I like that. And I'm curious to know what types of patients are you typically seeing throughout the course of a week, Casey?
Well, as I mentioned earlier, I'm at one of the businesses here in town.
Right.
And that falls into the industrial setting. And we call these people with work-related injuries industrial athletes. And that includes people who are doing a lot of physical labor with their work. And the more activity you're doing on the job, the more likely you are at some point to sustain an injury. It could be anything from a lot of the factory workers that I see have injuries from doing the same motions over and over all day.
Right, yeah.
And then on the other end of things, I see a lot of people with low back pain that's caused from sitting 8 to 10 hours a day.
Yeah.
And then, between those two on the spectrum, there's also people who twist a knee or an ankle, people who fall and injure something as they land the ground, and then other things like arthritis, or
Sure.
then people who've had surgery and are coming for rehabilitation.
Yeah, absolutely. We have to take a short break here, but when we come back, we're going to talk a little bit about provider differences right here at Upland Hills Health on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. There's a number of different professions here at the Therapy and Wellness Center at Upland Hills Health. And they include physical therapists, occupational therapists, personal trainers, and athletic trainers. And a lot of them they all deal with physical movement and rehabilitation, but each specializes in a different way. And so, Casey, I want to talk to you for just a moment here. A personal trainer and athletic trainer sounds very similar. Are they the same thing?
No, and it's a pretty big misconception that we hear a lot.
Yeah.
Personal training and athletic training are not synonymous. The personal training aspect is their education is more focused on fitness
Sure.
and personalizing a fitness experience for people. We also have different educational requirements. To practice as an athletic trainer, minimum requirement is to graduate with a four-year bachelor's degree in an accredited athletic training program. The program includes academic classwork and also a lot of hands-on clinical experiences. After completion of the program, the person is eligible to sit for the national board exam.
Okay.
And upon passing the board exam is when they become certified. From there is an opportunity to further your education and get a master's degree. And then across the country, every state is different in terms of registration, licensure.
Right, yeah.
But here in Wisconsin, we do have to have a license to practice athletic training.
Okay. In other states, maybe that's not the case. Maybe you don't need a license.
A lot of the states you do. Sometimes some states it's registration.
Sure.
It's just different.
Sure. And Mike, I want to just jump over to you for a second here. How is an athletic trainer different from a physical therapist or an occupational therapist?
Right, so there are a lot of similarities between all the professions, specifically the knowledge of the anatomy, the musculoskeletal system,
Sure.
The physiology behind things. The major difference would be, the licensure process, the amount of school in terms of, if it's a bachelor's, master's, doctorate, things like that. I think one of the major differences is as an athletic trainer, we practice under a supervising physician. Ours happens to be Dr. Dunn, so he's kind of our go-to guy.
Yeah, absolutely. I'm just curious to know here, and I'm going to jump over to, actually I'm going to stay with you for a second here, Mike, because I know that Upland Hills Health serves a lot of rural areas here in southwestern Wisconsin. What are the advantages of having athletic training available in rural schools?
You know, there are a lot of advantages. Specifically, it gives that smaller school kind of that same opportunity, that same experience as maybe a larger metropolitan area school might have in terms of having a sports medicine professional there that's able to help with, you know, care of injuries, prevention of things like that, just having someone there. And I think, you know, in terms of like as a parent, say for example, if your kid gets hurt or something like that, you have to take time off of work, you have to take time out of school,
Right.
things like that, to go to different appointments, do things that way. So if I'm at the school and I'm able to help them with, you know, an injury or an illness or something like that, it kind of saves some of that trouble of going different places. And you know, if there is something that is, say, out of my scope of practice, something that I don't feel comfortable treating or something like that, I can refer them to proper channels, kind of get them to the right place and save them some time in terms of, and costs in terms of like going somewhere and, you know, do I have to go there, things like that. So.
Right. And it sounds like, you know, you said even if it is out of your scope of expertise, you know, at the very least you can provide some sort of care until the parent is able to come and get their kid if it's a more serious injury.
You know, and if it is an emergency situation, recognizing the proper things to do in terms of stabilization or, you know, monitoring certain vitals or things like that until, you know, EMS arrives or we can get them to where they need to be.
I'm just curious, how often do you see injuries at the schools around here? I mean, the schools around here are fairly small. Dodgeville's probably one of the bigger schools, actually, but, you know, if you go to, you know, Iowa Grant or River Ridge or Lancaster or Platteville or whatever, I mean, there's got to be, I mean, there's not a huge student population. So do you deal with injuries pretty regularly, would you say?
I would say so. It depends because, you know, in the smaller schools, you have kids that partake in the fall season, the winter season, the spring season. So there really is no break. And then, of course, during the summer, they do all these clubs and whatnot. So, you know, you see a lot of chronic overuse type injuries carry over from sport to sport, and you try as well as you can to kind of manage those things. But, you know, sometimes getting those kids to sit out is very difficult. So, and, you know, if you do have a smaller team, having them sit out, it's, you know, it kind of can impact the team. So our job is just kind of really help them participate as much as possible. So, you know, it is very prevalent, unfortunately. That is why we're there. It does happen.
Yeah.
So, yeah.
I suppose you wouldn't be there if it wasn't
Exactly.
an issue.
If people didn't get hurt, we wouldn't have a job.
We'll take a short break and we'll come back one last time and we'll continue talking about athletic training here at Upland Hills Health. Stick around. And we're back on Wisconsin Doctors here at Upland Hills Health, and we've been talking about athletic training. And Casey, I just want to jump over to you because you guys offer workshops and other programs that are coming up this summer. And you have something specifically called the Sports Performance Clinic. Can you give us the details on that?
Yeah, the Sports Performance Clinic is something that we run every summer. We have a lot of fun with it. It's 8 weeks long, meeting 2 times a week. It's for kids ages 12 to college age. For anybody who's looking to enhance their athletic abilities. It is open to all skill levels. It does not matter. Everyone's welcome. The focus is on injury prevention. Some of the things we work on are jumping and landing techniques, core stability, and then some agility, balance, coordination. And just by the nature of the class and all the things that we have them do, there is a lot of conditioning involved as well.
Okay.
One of the things that makes this really fun is that we do pre-testing. So at the first class of the 8-week course, we'll test their vertical, their broad jump, a few other physical tests. And then in the last week of the course, we remeasure all of those same things again. And it's really cool to see a lot of the kids who come in and really work hard, see some pretty big improvements. So it's fun for us to see that these kids are excited that they've reached goals and they can see for themselves that they've made improvements with their hard work. And I think part of that is also why we get a lot of the same kids that come year after year.
Sure.
I think everybody who comes has a lot of fun with it.
I think it sounds like they not only improve their athletic abilities, but that eventually, I mean, will hopefully lead to less injury or the potential for less
absolutely.
injury.
Just by working on the mechanics and using their body properly.
Yeah.
A lot of that is just how they are able to improve a lot of their
That's
athleticism.
fantastic.
Yeah.
Donnie, I want to just jump over to you. Is there any basic advice that you'd like to give viewers or the people that you work with, whether they're student athletes or industrial athletes, to help them prevent or at least lower their risk of injury?
we could talk all day about it. Feel free to jump in anytime if you guys have anything to add. But I think for me, my biggest piece of advice is just to educate yourself on the risks that are associated with whatever activity that you're doing, whether it is in the industrial setting or if you're a high school student participating in sports. Know the risks that are associated with that activity, and then also just know the proper form or technique that also comes along with your activity, whether it's lifting something or proper throwing technique if you're a baseball player. And then my last piece of advice would just be realize that it's okay to ask for help. A lot of times we see people, that have had an ongoing problem, and it might not have been as worse, or they might not have resulted in a secondary injury if they had sought help sooner.
Sure. Yeah. Seek help as soon as the injury, as soon as you sustain the injury.
Know that it's okay to.
Yeah, it's okay to do that. Any other advice?
Just adding on to what Donnie said, it reminded me that there are a lot of companies that hire athletic trainers specifically to go through and work with all of the employees individually to teach them how to bend, lift, carry, sit at a desk with correct posture to prevent ergonomic injuries.
Yeah, absolutely. And then Mike, did you have anything to add to that?
Yeah, so I think one of the things I'm very passionate about is both the short-term and the long-term, implications, repercussions, whatever you want to say, the outcomes for these patients. And a lot of times we might think in the short term, but there's also the long-term aspect as well. How is this going to affect you when you're out of high school, into college, 20, 30, 40, et cetera, et cetera. So sometimes it can be a difficult conversation, but just talking to the patient about you've got your whole life ahead of you. Let's kind of think about everything, not just the short term.
Let's not peak now here, folks.
Yes, exactly.
People, and that's interesting because you always hear people talking about old sports injury, and some of these people who talk about this are well into their 50s or even 60s. And it's like, wow, really that long? Huh?
Exactly.
Yeah. So. Donnie Schraufnagel, Mike Shippick, and Casey Spangler, part of the all of the athletic training team here at Upland Hills Health. Thank you so much for the information. It's been a pleasure talking with you guys today.
Thanks for having us.
That's all the time we have for Wisconsin Doctors. From all of us here at Channel 57, we're inviting you to live longer, live better. We'll see you next time.